Hello, everyone, and thanks for joining us today in our virtual conference. Wish we could be live with you. Unfortunately, we all know the situation that's going on out there with COVID, so better to be safe than sorry. But I'm glad that we can connect together and talk about today's topic, which is enterprise virtual care. We're bending the cost curve of chronic care and beyond. It's a really exciting transformation that's going on in healthcare, funded or fueled by kind of a difficult set of prospects in COVID, but advancements in telehealth, telemedicine, the way we approach patients today is pretty different and increasingly different over time. Well, at Orb Health, we were already working with Health Choice Network and the community health centers of Pinellas to actually advance that type of transformation well ahead of COVID. And this kind of just showed exactly the reason why we needed something like this. So today, we're actually going to take you through what enterprise virtual care means and how that was able to work with the CHCP to drive their outcomes in a whole way that is well beyond what they had originally thought. And we wanted to share that prospect with you. Also share with you how those results are continuing on as they expand care and how that can apply to you. So my name is Chad Jones. I'm with Orb Health. I'm Chief Strategy Officer with the company. Orb Health has been a partner with CHCP for a while, but has just recently expanded our partnership with Health Choice Network. We're actually an exclusive HCN partner for chronic care management, transition care management, other chronic care elements, and patient support services. We're also a visionary sponsor, the marquee sponsor of this session, or I'm sorry, of this conference, and we're very proud to do so. Now, even though we are recording today, we are live chatting as well, so there is open text for you to come in and look at, to come in and ask questions during the session and certainly afterwards, and then we'll be able to text with you as we go and answer any of those questions, so please feel free to do so. The partnership between Orb and Health Choice has radically expanded since we started a few years ago. We've implemented not just at the CHC Pinellas and have seen some tremendous results that we'll take you through today, but now we've been expanding quickly into other centers as well that are starting to see these benefits. Today, we wanted to share exactly what is enterprise virtual care, why it's important, and then talk about how we applied that inside of the HCN clinics and then show what those results are. And then we can also show you how that can be applied to your practices as well. So why don't we get into it? Healthcare is really facing a crisis in care capacity. It's lowering outcomes, it's driving up the cost of healthcare. And we're seeing that across the board from Medicare to health centers to providers and down to the patients. Now, some of the reasons for that is if we look at Medicare, there's explosive patient population growth, right? There's a bunch of waste that goes on in healthcare as well. It was interesting to find out that 20% of all healthcare spending is actually waste. That was from JAMA. It's driving up costs because we have so many of our population is turning over 65. They're coming into Medicare. And that spending is going through the roof. Health centers have a lack of resources. Reimbursements have been going down about 2-3% a year. That directly affects how many people you can hire, the budgets that you have. And when we start looking at Medicare programs, things like chronic care management, we want to be able to implement those and then be able to support our value-based programs. Well, it's getting more and more difficult. It's actually a 6 to 8%. I'll correct myself, a 6 to 8% reimbursement drop every 2 years. 50% of our OpEx is labor costs. And we're also seeing over a 30% rate of unnecessary emergency department utilization for the chronically ill. And that's incredibly expensive, especially when you consider that 22% of any of those ED visits become hospitalizations. Providers, we have a shrinking physician pool. And it's overwhelmed. That restricts patient access. Nurses are filling some of those gaps, which is great because there's a 225% increase in nurse practitioners, but we still have a tremendous shortage of doctors. Another interesting fact is that 2 out of 3 Emergency department visits can be headed off if you just had a conversation with a nurse. So how can we actually bring those together to help offset, a lot of this cost? And then you have patients, they have difficulty discovering and navigating and accessing an ever-changing myriad of services that are out there for them. The more services that you can provide is excellent, but if they can't find them and access them and it gets confusing, it's very challenging for them, especially people who are chronically ill. And they already have challenges managing the breadth of their care. 70% of chronic users don't even use a portal, don't even use the portal. So they're relying on calling in. And you have challenges, on the side of that. 52% of them said that there's major problems when dealing with their care. When we look at chronic care, there's an ongoing chronic disease epidemic in the country. There's over 133 million people with one or more chronic ill conditions. 6 in 10 people have a chronic disease. 4 in 10 have 2 or more conditions. There's over 10,000 baby boomers turning 65 daily as well. So of the population that's 65 plus, 3 out of 4 actually have 2 or more chronic conditions. Well, the chronically ill actually represents 71% of total U.S. healthcare spend, 93% of total Medicare spend. That's 3.5 trillion annual U.S. healthcare costs. That's a tremendous amount of money that is being used out there. So this population needs to be serviced, but it's a huge population and it's ever growing. So Medicare had come out with, the chronic care services, things like CBT 99490, chronic care management. You have transition care management, remote patient monitoring, principal care management, behavioral health. All of these things tie together and apply to the chronically ill. Now, CHCP and HCN wanted to be able to address this patient population. Well, in order to do that, they needed to be able to find who they were, see if they're eligible, enroll them, because there's an enrollment requirement. Even if it is just verbal, you still have to go through that process. And then you have to service them for 20 minutes of non-face-to-face time, which means primarily over telephone. And there's fundamentally a problem here, because if you think about it from a pure telehealth standpoint, well, not everybody has a data plan or a smartphone or something that they can actually do telehealth or work with an app on. It's mostly telephonic. I just call, and I got to call landline sometimes, and actually deal with this population. Well, there's a lot of challenges inside that. We look at, on the screen where current set of services are. Well, there's all the services that on the very bottom here, where the inpatient, outpatient services, telehealth services across primary care, pediatrics, internal medicine, hospitalists, infectious disease, and the litany of other programs that are there that are available, as actually all the records are tied through the EMR. But I've got to be able to now address those patients through the phone. Well, the way that we have it today, there's not enough. There's already not enough, admins and nurses to take those calls and doctors to take those calls. And there's a long time to get people back and forth and get them the answer they need just in today's, setup, which mirrors what you see typically on your phone, on the screen here. Well, if we're going to inject something like chronic care management, well, that's a significant program that requires a tremendous amount of different requirements and regulations. And it's not just one program. It's not just chronic care management. It's also transition care. It's also remote patient management. It's all monitoring. Sorry. It's also behavioral health. And I've got to be able to determine eligibility. I've got to enroll them in a program. I've got to do billing, training, compliance services on top of that, and have all of those workflows somehow integrate into the EMR so that I know how to do those things. Well, that's incredibly difficult. I can't just snap my fingers and put a software-only solution in and make those protocols come to fruition. Not to mention, the reality is I already have an overburdened staff that costs a lot of money and has offices and things like that I have that can't address the patient needs I have today, let alone the needs I'm going to need for implementing chronic care services. I'm going to need dozens, if not into the hundreds of staff to make that happen. Well, you don't have the budgets to do that. Our reimbursements are already cutting down. So how are we supposed to expand that care capacity to really be able to manage that and do this in a time frame that rapidly brings value to the patient populations and deals with their outcomes. So this was the problem that CHCP was facing. We came to them, it was around 2016, I believe, implemented our program and kind of, took their ability to take the special touch, their standards of care, those things, and apply it into what we call enterprise virtual care. And we were able to rapidly change and transform how they can address these patient populations. So enterprise virtual care rapidly enables the scalable delivery of chronic care, patient support, and outbound clinical campaigns as a virtual extension of the health system without adding staff, apps, infrastructure, or budget. Now, you might ask, well, how am I able to do that? We'll get into that in a moment. But the value of that is can't quite be understated, and we'll show you how that worked in real life here in a little bit. Significantly improves patient outcomes, and that's the first and foremost the problem that we need to solve, is how do we make people better, right? We expand care access, increase visits, able to increase health system reimbursements as well, decrease ED utilization and hospitalizations, which is a huge cost driver, accelerate and expand the annual HCC scoring, improve value-based care profitability, and bend the overall cost curve of healthcare, and do that organically by keeping people out of costly services, because we are able to do that in a preventative manner, right? And be able to head things off. And we can do that in a very exciting way. So if we go back and we look at what we just left, trying to build this organically, well, it's again the budget, the resources, the time just takes way too long. CHCP saw that, HCN saw that. We also have seen other customers that tried to go on their own path, and they ended up taking a year or more to implement a solution, and they ended up with an enrollment rate of about 2%. That's incredibly low for all of that time and money and all of those things. In reality, when you put in an effective solution, you should be seeing enrollment rates around 70%. And that's what we're seeing right now through CHCP. So if we think about how we transform this model, so what'll happen now is, instead of the health center having its own call center and those things, well, we still have all of the services that are at the bottom in the dark blue. All of the primary care, pediatrics, all of those services are there. They're delivered as inpatient or outpatient services or through telehealth. Telehealth still remains an important vehicle for delivering that care, but it's not the end-all be-all. All of that ties in with EMR, of course, and the EMR needs to remain that patient record of truth, right? That's where all of the interactions lie. That's where billing ties into compliance systems, all of your value-based care tracking, right? So that needs to stay there. And that was a fundamental requirement when talking to CHC Pinellas. We had to keep those things together, but it also enables something else. That's the central point of collaboration between the different members of the care circle, right? The providers look at that and see what's going on and look at the charts and those things. And patients also can come in and look at their chart. So that's it had to be key to remain that center focus. However, what Orb did at this point is then bolt on top of those services. So we're able, through an interface called Redox, have a bidirectional EMR data sync. Our virtual care cloud actually will synchronize with the EMR both ways. So any interactions and the things we do from our services standpoint inside of Orb will then be fully synced back into the EMR record. So you always see what's going on when we interact with the patient. That creates this integrated platform, this integrated cloud that allows us to organize all of that patient data and present that in an organized fashion, and also provide AI-based predictive analytics and those types of things to our call center. Now, inside of that care cloud, we have services that wrap whatever type of service program you want to deliver, right? In this case, it's the chronic care suite of services. So what you really need to understand is that you have to discover the patients that are that would be eligible for this program, then determine their eligibility. Then you must enroll them through a verbal communication. Then make sure that the billing is all set. for the different CPT codes. Make sure that training is ongoing, and make sure compliance is tied into this whole thing. All of that combines with the care workflows, process, and protocols that are required to make this work. Now, inside of the enterprise virtual care solution, those care workflows, process, and protocols have a whole set of things that are specific to doing this as a set of outbound campaigns. But CHCP has their own best practices and standards of care. So we merge those two things together to make sure that you have your touch, what makes CHCP so unique in their care, and bring that into a system that enables that to be integrated into a scalable delivery system that expands care capacity. Once that's all organized, then we present that to the Universal Patient Engagement Center. That's a call center that includes very experienced admins, licensed physicians, and nurses, nurse practitioners. Now, that's a remote service, right? But those people in that call center, in that Universal Patient Engagement Center, are actually acting incident to and in the name of the practice. So we're able to put in a set of telephone numbers, emails, those types of things that look like they're coming right from the actual practice, and we talk to the patients in the name of your practice. This is Nurse Jones, and we're calling, and I'm from Dr. Jones's office from CHCP. So the patient doesn't know that there's any sort of gap, right? It's completely white labeled. And we communicate through a number of means: secure messaging through the portals, email, text, telephone. Like I said before, it can't just be, there's no app, because not everybody can take the data or the app. You do it the old fashioned way, telephone, and it's quite effective. We do have a level of escalation inside of the Universal Patient Engagement Center, so that we can address their issues as quickly as possible. Remember, I told you that 2 out of 3 emergency department visits are headed off by simply talking to a nurse. Well, we're able to do that in an immediate fashion, not a, hey, I have an issue, let me call you back, all those types of things. We're able to handle it immediately. Our goal is one-touch resolution, right? And that aligns with the vision that HCN has for their patients and is now offering as a service across all of their clinics, or to all of their clinics. So now this system comes together and is able to present a set of workflows that goes out and automatically discovers the patients that are right for the chronic care services, determines their eligibility automatically as a programmatic service, and then presents that as call lists, does auto calling out as an outbound enrollment campaign that our Universal Patient Engagement Center handles, and then through any of these means, and then confirms the enrollment, begins to do the actual care servicing. Again, all of their interactions are brought back to the EMR. They collaborate with the brick and mortar doctors so that they ensure that we know that if there's any sort of exacerbation, something like that, we can call the doctor. They understand that, they see it in the EMR. And again, the patient gets a seamless experience that actually scales care capacity. Because if we need, guess what? We need more nurses, physicians. That's not CHCP's problem anymore. That's not your problem. Orb Health takes care of that, and we're very good at ramping up those services very quickly. We train them, take care of them. All you know is that there is always someone there 24/7 to deal with this, especially for chronic care. Now, beyond that, this whole system has a modular set of services. So chronic care is one of them, yes, and all of the chronic care services underneath it. But we also offer admin and clinical patient support. I want to be able to handle scheduling as an outbound. There's annual wellness visits. I want to be able to, as a part of an outbound campaign, I want to be able to, ask for mammograms, and run one of those programs. We can do that, or enrollment programs into other services. All of this is simply adding in additional workflows, processes, modules into the system. And again, it scales incredibly well. An example of an outbound campaign that we recently did with CHCP is for the pandemic, is for coronavirus response. Back in February, we saw the ramping cases, in the Florida clinics, and we were able to work with the chief medical officer of CHCP, and we rapidly brought together a set of workflows and processes within 2 weeks, and brought that up into the virtual care cloud, And our Universal Patient Engagement Center started reaching out to people for testing, giving test results, and then doing scheduling follow-up for coronavirus positive people. So that way we were able to very streamline the response to the pandemic and do it very quickly. And then as the pandemic winds down, we'll wind down that service. Let's hope that's soon. I'd love to see y'all in person. So what makes up these? What makes up this enterprise virtual care, right? Well, there's 4 key components. The first part is the virtual care cloud, and that's what ties the systems together into the existing EMR. It's non-intrusive, and there's just a bolt-on through an API. Doesn't take very long to bring that in because all of the clinics that are part of the HCN network and are part of something called Redox, we tie right into that, and it gets us to the EMR. Our Universal Patient Engagement Center, as I mentioned. And then our modular programs across patient support, chronic care, outbound campaigns, and then, and most excitingly, the data aspects of what we do are AI-driven patient intelligence. So let's go through kind of what those look like. So the virtual care cloud, all HIPAA compliant, secure, built on Microsoft Azure, so very healthcare friendly. We snap into the EMR, so we're not intrusive. All the same portals, same compliance, all those things all continue to work, and we inform those with much more data so that it ends up being something that you have a much more efficient visit because I have all the data at my fingertips. All of the billing, we actually handle all of the compliance and billing aspects and make things audit ready on the back end before we synchronize that back over into the cloud. So everything should be very ready to be billed, ready for an audit, all of those things once it comes over back into the system. This informs and prioritizes the patient data for those workflows, and it's completely seamless to the actual practices. There's no interface for the practice to log into, anything like that. This is so Orb can prioritize data and information for the Universal Patient Engagement Center. As we deal with those patients, the EMR remains the centralized patient record of truth as always. And then our Universal Patient Engagement Center is scalable admin and clinical service layer. As I said, operates in the name of and incident to the practice, seamlessly services the patient population. And what's great about the one-touch triage, if I have multiple programs and I see that I'm dealing with a patient and I'm trying to schedule them for a visit, because they have they had a single issue in the past. Well, now once I'm talking to them, the nurse that's dealing with them can see an alert that says, oh, hey, they're eligible for these other programs, eligible for chronic care management. And right there, they can say, oh, well, let's deal with your issue, get your annual wellness visit done. Oh, by the way, I also see you're eligible for chronic care. You want me to enroll you in that? Here's what the program looks like. So that way, we're dealing with multiple issues while I've got the patient on the line. And then we can go out and reach them and then allow them to actually get a whole spectrum of care. And that really allows us to transform the call center from a cost center into a profit center, because we're bringing in and scheduling more visits, outpatient visits, more telehealth visits. I mean, we can schedule anything that is available from the service, whether inpatient, outpatient, or telehealth. So then the care management services that are provided are discovery, eligibility, and enrollment. The success rate for our outsourced enrollment is about 68 to 70%, which blows away the industry average. There's monthly care delivery, 24/7 availability. There's compliance oversight. There's integrated billing as well. And again, we take care of all of that formation of those records before we sync them over so that they're ready to go once they come over to the EMR. Our care delivery coordination goes across the entire range of services that the health system provides. And again, 24/7 care access, and everything that we do is back to the master schedule and all of the patient records in the EMR. So that establishes collaboration as well. Not only does the Orb patient services, the Universal Patient Engagement, they're able to do all of these things, but as they sync them and the doctor treats the patient, well, we can see that too. So that way we can continue to have this, the continuum of care stays intact as we move patients through the services. The programs are modular. The three categories, as we had shown, first of all, chronic care in the middle here, chronic care, transition care, principal care, remote patient monitoring, behavioral health. We offer all of those CPT reimbursement codes today. And then patient support, proactive and reactive patient engagement, issue triage and appointment scheduling, scheduling registration, immediate answers from a medical provider to head off those ED visits. Because sometimes it may be something they don't have to go to an emergency department about. They're calling in and they just need an answer. But if they're waiting half an hour for a callback, they may say, well, I'm not going to be, I'm going to be better safe than sorry and go in anyway, right? So we head off a lot of those. Then outbound campaigns, we talked about a little bit about the COVID side, but emergency services, a hurricane's coming. You have patients that need their medicine. They might be away from it for a couple of weeks. Well, let's make sure that let's call ahead and make sure they have the medicines they need, food delivery, things like that. Lab reviews, preventative screenings, annual wellness visit, enrollment services. All of those things can be brought together, and it's a pick or choose. I just want to do chronic care and CPT 99490, fine. But if I want to expand that, I can rapidly do that. Do it over time. I can do it immediately. I can start off with chronic care and then move into patient support. That's what CHCP has done. But all of this brings tremendous value. And then the patient intelligence aspect is incredibly important. As we pull in from the different centers into the data into the cloud, we're able to have our AI engine between neural networking and machine learning look at the different data sets and come up with non-intuitive correlations between disparate data sets for a patient. The result of that is being able to present a full range of KPIs and data that supports what's going on with those patients and their care, do that over time, look at the historical aspects of that, and feed back into the workflows so that we're best addressing how patient care is done. We share that with our customers, of course, with you, and we're doing that with CHCP and help better service the patients just by learning automatically across patient care data, metadata, health statistics, care patterns, prescription utilization, exacerbations, RPM data, all of those types of things. Already, we've had a couple examples of how this has had some good success for us. So we have some predictive intervention that has occurred as well. One case, a 72-year-old female, heart disease and diabetes are her current conditions. There was a blood sugar spike. She's thirsty. That alerted the nurse. The nurse then turned around and notified the doctor. They increased the medication, tracked her every 2 hours, and brought down her blood sugar, avoided an ER and hospital visit. Male 74, hypertension and diabetes. He got an alert that there was a 2 to 3 plus edema bilateral lower extremities reported. So notified the doctor, increased the meds, had the patient raise the extremities, lower their sodium intake, and the edema decreased to +1 within 24 hours. Normally they would go to the hospital for that, right? And you'd have an overnight hospital stay for things like that. We were able to head that off and save that money. Now we learned from that as well. The AI learns from that, so that whenever it's seeing these types of things across other patient sets, it will set alerts and let our patient center know, and then the doctor in the brick and mortar know, this is what's going on. Let's help this patient now, but we can keep the cost down and get a better outcome for that as well. So as we implemented inside of community health centers of Pinellas, Elodie Dorso, well known, she's the CEO there, work hand in glove with her and the HCN group. We're working in they're an FQHC with an ACO and working inside that accountable care organization. So we implemented chronic care management first and then expanded into transition care. And then we looked at going into, or we've now recently expanded into patient support aspect of things, and then of course doing COVID response and those types of things. The results have been nothing short of spectacular inside of a very short amount of time. Now, we did start this back in our implementation back around 2016. This data has been coming out, and we have recently expanded over the last year into the patient support services. But what CHCP has been able to see is pretty tremendous. So starting at the top here, we've been able to close 70% of care gap quality measures for the patients. So that's increasing their health. We've been able to improve the actual coding aspects of the patients by 14% because our system's able to look at them and say, hey, what are the proper codes? Do it both programmatically and our nurses, as they're going through and dealing with patients, spend the time with them to properly code them and make sure that they're receiving all the services and the providers are receiving the credit that they get for providing that service. We resulted in about a 26% annual ACO patient savings. That's a tremendous amount of savings. We'll go in that in a moment here over to the right. We also realized an 11% annual HCCRF scoring improvement as well. And that goes directly to the profitability aspects of the reimbursement that you get from for lowering costs and those things and the quality inside of the ACO. We also are able to track 56 MITS metrics as well. We also increased outpatient appointments by 22% and brought schedule utilization to 100% within 2 weeks of implementing an outbound campaign to do annual wellness visits and those things with the patient population beyond chronic care, right? So again, that's inpatient support services. From a chronic care perspective, going back to a third-party study that looked at the before and after of Orb Health and Enterprise Virtual Care in CHCP, we actually saw a 54% emergency department utilization decrease across chronic care patients with 6 or more concurrent conditions, which are the vast majority that actually use the emergency department, drive up the cost. Now, of that, 22% of the actual emergency department visits turn into hospitalizations, and that's a much larger cost, obviously. So by reducing by 54%, we were able to subsequently reduce the number of hospitalizations. That resulted in a $6.2 million savings over annual savings for every 1,000 patients, and that's a Medicare savings. So we're saving Medicare a tremendous amount of money, and that goes directly to the cost savings for the ACO that gives you the bonus at the end of the year as well. If we look at the actual cost savings in numbers, before Enterprise Virtual Care, there was a spending of about 23.1 million. This data has just come out, over the last month. We did this study. And after looking at the spend post putting in Enterprise Virtual Care, it's about 17.1 million. That's a savings of $6.02 million, 26% annual savings. That's tremendous. From a revenue perspective, call center utilization, chronic care management, behavioral health fee for service, and the TCM fee for service, which are all CPT codes, we were able to increase revenue by $20 million. Right now, that's part of that we've already seen along that curve. Part of that's projection, but we're already right along that curve. So between the actual outcomes of seeing how we're closing those care gaps in quality measures, how we're able to increase the scoring so they're getting patients are getting the services they need, we're dropping the cost, significantly, and dropping, increasing the outcomes by dropping the need to go to the emergency department, keeping people in their homes, especially during a challenging time with COVID. The places you're going to get COVID is going to be the hospital, the pharmacy, or the grocery store, right? So keeping these, highest at-risk patients at home and then lowering their need to come in and giving them better outcomes is a tremendous thing, while saving money and increasing the revenue, which everyone's looking for now because COVID did put quite a wrench in the reimbursements and the normal scheduling and those types of things. Telehealth hasn't fully recovered that, right? But we have a way to actually increase that across the board and do it significantly. From a chronic care perspective, CMS shows that there's about an 18-month ROI typically. With Orb, we saw that in 9 months. We're actually seeing that as little as 6 months now. Now, there's no out-of-pocket cost for the most part to implement this solution, and we split the reimbursement revenue with you, right? So that way you don't have to pay us out of your pocket. All of that money, all the reimbursement goes in through the top line to the providers, to the actual health system or clinics, health centers, and then we actually put an invoice against that once it comes in, and you split it out. So it's technically only money coming out of reimbursement. We're able to deliver that value, 6x faster than a normal CMS implementation of chronic care. I mean, that's pretty tremendous to be able to get there through virtual care. Elodie Dorso is the CEO of Community Health Centers of Pinellas. I'm sure many of you know her, heard of her, interact with her. A tremendous partner working together with Orb, and we're incredibly excited to be delivering these results for her and for the patient population of CHCP and of HCM. So her quote, like many federally qualified health centers, CHCP is always looking for ways to implement innovative solutions to decrease the cost of care while also improving the patient experience, especially for those with chronic disease. This dramatic reduction through enterprise virtual care in costly ED and hospital readmissions after only 1 year is encouraging for not only CHCP and our patients, but Florida's entire FQHC community. That's why the strategic partnership that we've done with Health Choice Network is now offering these services across the board to all of the clinics that are part of the Health Choice Network. And of course, Orb Health stands ready to bring those solutions out to the Chicago Alliance, any other clinics, health systems, FQHCs, ACOs that need this and want to go down this path. We're here to quickly implement this and get you those same results that we're seeing here and in other clinics inside FQHCs that are part of the ACO inside of the Health Choice Network. So what does this really result in, right? What's the end value of this? Well, we started with the challenges between patients and providers and health centers and Medicare, right? Well, we're really enabling unprecedented economies of scale that provides patients with coordinated care access that leverages all providers, resulting in a significantly reduced cost curve. The Universal Patient Engagement Center allows us to hire a tremendous amount of nurse practitioners, which there's a huge and ever-growing pool that can address patient needs that a physician doesn't necessarily have to focus on. And we can do that cost effectively. We do have physicians on our team that we can do first level escalation to, but really we're focusing the brick and mortar and telehealth physicians on the patients that really need to see them, right? The ones that are exacerbating, the one that have expanded comorbidities, those types of things, right? That allows a greater efficiency through the system that enables scalable care capacity. And that's the key, because that increases patient access while lowering the costs, right? So patients get immediate triage and expanded access to care providers and services that reduce their emergency department visits and hospitalizations. That improves their outcomes, that improves their mental state, depression state, all of those things play hand in hand. The providers, we can leverage those PAs, RNs, ARPNs as scalable care capacity while focusing doctors and patients that need that help. Health centers can scale care capacity in general as needed, on demand, just in time, without additional resources, without having to go hire FTEs or bring in other applications that people simply won't use. And we don't have to train doctors. There is no additional app. It's your EMR. And that significantly lowers the cost curve. And Medicare gets a scalable model to handle the exploding patient population that increases outcomes and Medicare savings. It's not just Medicare as well. This can be applied to Medicaid. It can apply to any other patient populations like we did with COVID. So it really results in the transformation of healthcare that truly gives us a way to scale and bend that cost curve as we saw. 26% is a tremendous amount of savings, and there can be more as we expand. And of course, this maximizes the value-based care opportunities that are out there. We can move from a fee-for-service to a value-based care reimbursement and optimize that, then eventually move to the optimization of value-based care with shared savings, HCC scoring, all of those things, and really maximize the profitability that we have while we're increasing those outcomes significantly and dramatically. Together, we can transform healthcare. This is the model forward. The top layer of enterprise virtual care that expands services, allows patients to understand what they can access, and helps get them well while we're focusing all of the brick and mortar and telehealth, inpatient, outpatient services on the patients that really need them the most. Together, this is the way forward. CHC Pinellas and HCN have seen tremendous and significant results going down this pathway. And we're actually excited about that tremendous partnership when we look with a very optimistic eye to the future and what we can do together. We'd love to be able to extend that into your world as well. and help you help your patient populations achieve the same success. So again, my name is Chad Jones. I'm Chief Strategy Officer for Orb Health. You can come and check us out at www.orbhealth.com. The live chat is open, so please feel free to text questions. We will have a few people on that will be able to answer those, and then also make sure to stop by our virtual booth. Virtual booths are an interesting concept, but we have a lot of information there, studies, infographics that go through a lot of this. We can answer your chat sessions, and please feel free to schedule a meeting there or at orbhealth.com so that we can meet with you and address your challenges with this Solution 101. Ladies and gentlemen, thank you for your time. There is an additional session that I have coming up as well. Please look for that on your session agendas. And I look forward to seeing you at that session and in the future. Until then, be well.